Excellencies, ladies and gentlemen, and dear friends, warm greetings from India. I am Professor Sunil Joshi, Vice Chancellor, Uttarakhand Ayurveda University. It is my pleasure to interact with you through Word Forum. I am pleased that Word Forum gave me opportunity to interact with you. I am talking about the Ayurveda and artificial intelligence. In present scenario, one has to know the application and significance of artificial intelligence in the globalization of Ayurveda. Ayurveda, the science of life, is the oldest scientific medical tradition of India. Ayurveda is one of the most popular ways of healing globally, which comprises number of medical concepts and hypotheses. Ayurveda gives relief in many acute and chronic ailments without any adverse effects. Ayurveda has ability to cure diabetes, hypertension, cancer, chronic allergic manifestation, digestive disorders, and many more diseases. So for the updating and propagation of this ultimate medical science, there should be inclusion of recent technology that permits computer and machine to work in an intelligent way. After the COVID-19, everyone is very much aware of the limitation of allopathic science, and we have seen the scope of Ayurveda in every aspect of illness and wellness. The whole world is amazed to see the contribution of Ayurveda regarding the management of COVID-19 by boosting the immunity system through many herbs and herbo-mineral preparations. In the scenario for popularization of Ayurveda globally, the challenge was to establish it to international market. Today, whole world is looking the emerging market of Ayurvedic medicine, nutraceuticals, food supplements, and cosmetics globally. As we know that India itself is the second largest consumer market in the world. After COVID pandemic, everyone is aware of the adverse drug reactions and harmful effect of chemicals which are used in allopathic medicine as well as in cosmetics and nutraceuticals. Ayurveda is based on natural resources as herbs and minerals and used by 70% of Indian population in many ways. Now it is popular globally because of its efficacy, minimum side effects, and cost-effective therapy. However, it is mandatory to maintain the international quality standards of Ayurvedic drugs to compete with the international brands. For this reason, inclusion of artificial intelligence is very necessary with the Ayurveda. Ayurveda with artificial intelligence is the need of the hour for giving relief to the suffering humanity in masses. First of all, we have to know about the artificial intelligence. In computer science, the mechanical or the machine intelligence shown by the mechanical system is known as artificial intelligence in comparison to natural intelligence shown by humans and animals. After the invention of computers, use of artificial intelligence into the business, engineering, healthcare, and many other walks of the life is increasing day by day. Judicious use of artificial intelligence in Ayurveda is very important for application in diagnosis, treatment, prevention of disease, and propagation of Ayurveda. Recent technology are incorporated in the field of Ayurveda is taking place in various forms. Basic information about the fundamental of Ayurveda is very necessary. Teleconference and e-learning system, especially in COVID-19 pandemic period, for the teaching, training of Ayurveda in more than 500 graduate and postgraduate college of Ayush system. To share the knowledge of Ayurveda, teleconference, e-CME, e-lecturing is very important for the diagnostic purpose and problem solution. Instrumentation for the Ayurvedic diagnosis, and it is known as the Prakriti Parikshan, or it is also known as assessment of the constitution. Second one is the Nadi Parikshan, the pulse analysis, robotic surgical or the parasurgical procedures. They are also very important. The role of artificial intelligence in research to understand the drug delivery system and drug pathway analysis is very important. Absorption of drug and its action at the site is also very necessary to know. The implementation of artificial intelligence will provide new dimension to the Ayurveda. Before that, standardization of Ayurvedic diagnostic procedure and therapeutic aspects should be done properly. A number of researches have been conducted for Ayurveda-based disease diagnosis using artificial intelligence in different national and international centers. Assessment of Prakriti and the Nadi Parikshan, Dosh Parikshan are based on artificial intelligence. Pulse diagnosis is non-invasive, ancient method of Ayurvedic disease diagnosis through pulse, by which a number of informations are achieved for the accurate disease diagnosis. It is very important way to assess the physical, mental and emotional imbalance of human being during the healthy and disease state. Personalized wellness regimes like Sadvrit, dietetics, Panchkarma procedures and other procedures of detoxification can be implemented easily through inclusion of artificial intelligence in Ayurveda. The Ayurveda is based on the dosh, dhatu and mal principles. The disease is the outcome of those dhatu and mal imbalance. Vat, Pitta and Kapha are three important physical humors. Balance of tridosh is the state of health and imbalance can cause disease. The healthy state depends upon the balance of the dosh, agni, dhatu and mal. The pleasure or happiness is positive emotional state of feeling of wellness of soul, sense organs and mind. All these factors are important for the healthy state. The diagnosis of the disease in Ayurveda is based on the Ashtavit Pariksha, and that is the Nadi Pariksha, means the pulse examination. Second one is the Mutra Pariksha, the urine analysis. The Mal Pariksha means the stool examination. Jiva Pariksha means the tongue examination. Shabd Pariksha means the auscultation. Sparsh Pariksha means the palpation. Drik Pariksha means the eye examination. And the Akriti Pariksha means the general appearance of the patient. A lot of work has been done by many researchers for the assessment of a state of Vat, Pitta and Kapha in the human body through VPK pulse reading using the optical sensors so as to assess the Prakriti or the constitution of the patient. Darshan, Sparshan and the Prasth, which is known as the Trivid Pariksha, is threefold Ayurvedic diagnosis procedure with inspection, palpation and questionnaire. A comparative study of implementation of various techniques for pulse sensing through sensors was done by many researchers. By sensing, pulse diagnosis instrument was also evolved as an outcome of the researchers. Ayurveda is Indian or the Vedic system of the medicine originated in Indian subcontinent. Now this system of medicine has been combined with artificial intelligence. It became more high-tech, more credible, more acceptable, more popular globally in recent years. It is apparent that Ayurvedic medicine is cost-effective with least adverse effects. Inclusion of e-commerce and artificial intelligence can be used for the expansion of Ayurvedic market by significantly improving customers' experiences. Economic application and cost reduction, revenue generation and resource utilization can be done with the inclusion of artificial intelligence in Ayurveda. In day-to-day life, people are keen to solve their problems with the use of technology, and in Ayurvedic practice, a lot of problems are there. Data keeping and use of diagnostic tools may help a lot to the Ayurvedic doctors in their day-to-day practice. Now it is well realized that Ayurveda will have to incorporate technology. Every Ayurvedic doctor and the paramedical staff have to understand the basics of technology and how it can be used, what is the way for successful deployment and to maximize the outcome. We must understand various dimensions of artificial intelligence. Those who are not using artificial intelligence in Ayurvedic practice will be out of the sync, leading to a crisis of relevance and existence. We have to learn more and more with the experience of the experts who deployed artificial intelligence in different areas of Ayurvedic practice. Thank you. Thank you very much.